cultural differences are something, you know, they certainly impact how we interact with our medical providers and how we obtain medical care. And so I think a challenge that a lot of patients may face is really just concerns and interest around having a healthcare team or healthcare provider that understands how you make decisions, you know, what's important to you, what your concerns are, what you take into account as you're deciding what it is you're going to do in order to those steps and to treat illness. You know, next is chronic symptoms, and these are kind of those day-to-day struggles that a lot of MS patients may experience. And a lot of you may know, you go to see your doctor and they say, you know, everything's great, your MRI is stable, but you may be sitting there like, yeah, but I don't feel great. And so those are those chronic symptoms that can oftentimes provide challenges. Next are access and resources. So these are, you know, access to medical care, resources to certain things that are available that can really improve quality of life. Those are sometimes limited. There are other things that may impact someone's availability to those things: medication costs, transportation, time off work. So all of those are potential challenges as well. And then worry and stress, right? There is a lot, especially early on after a diagnosis, a lot of fear of the unknown, kind of waiting for the other, something bad to happen, stress about the future. That unknown can be extremely hard to live with at times. We know that with any sort of chronic disease, mental health concerns are certainly something that arise. With MS in particular, we do see higher levels of anxiety, higher levels of depression, and there's oftentimes this adjustment with being diagnosed and getting used to all the things that entails. Go ahead, next slide. So we'll just discuss briefly a couple methods or things that I think are important in order to combat some of these challenges. Next slide. All right, so first, it's incredibly important to understand your own disease state and the goals of treatment for yourself. It is always extremely challenging for someone that is living with MS not to compare your experience, whether it's the medication you're on, how you're responding to that medication, what your symptoms are, to not compare that to someone else, because it's always so incredibly unique. But as a patient, it's important for you to know what type of MS you have. So when we talk about the different types, there's relapsing remitting MS, which is the most common type. There can be secondary progressive MS, which starts off as relapsing remitting, and then some progression can start, and then primary progressive MS. And it's important to know what type you have, because there are implications with regard to what treatments you're on, what to expect from those treatments, and also what your prognosis is. Next, it's important to know what your MRI looks like. And you know, I have patients all the time, sometimes, and I won't say all the time, but not infrequently, that don't know that, for example, they have spinal cord lesions. And that's important. So when you think about how MS affects the central nervous system, you can have involvement of the optic nerves, the brain, or the spinal cord. Sometimes all areas are involved, sometimes just one. And it's important to know where your involvement is, because again, there are implications with regard to treatment decisions, potential disability, that sort of thing. You also want to keep track of whether or not over time, as you're being followed, there are any new lesions. And this goes for people who are on treatment or not on treatment. It gives you an idea of how the disease is behaving. That kind of goes to the third point. How do you know if or how your treatment is working? Well, the MRI is going to give us the most objective evidence. It's rare that someone can't get an MRI, and that happens, and we certainly work around that, but a lot of our diagnosis and monitoring does center on MRI, because it's advanced a lot and it gives us a very good idea of how the disease is behaving. And so essentially, if you're having new lesions over time, that's something that will, at minimum, it deserves a discussion about whether or not you need to change treatment. Some of you may or may not have heard of what we call NEDA, or no evidence of disease activity. So that is always going to be the goal of treatment, that you're not having new lesions, that you're not having new relapses. Ideally, though, as well, not having progression. Relapses and new lesions are a little bit easier to concrete, see this is stopped. The progression piece is harder. Okay, next slide. All right, another really important thing to do is to develop a relationship with your healthcare team to the point where you feel comfortable expressing all of your concerns and all of your needs. And this really kind of starts with trust and having faith in your team and that sort of thing. It also really comes down to being an advocate for yourself and speaking up for yourself when that's required. And that doesn't mean that if you don't have that relationship already that you need to go out and find a new doctor, but it does mean that maybe modifying the current relationships to where it gets to a better point, so that you're taking on a bit, an active role in your care, and that you feel like you're being seen and heard. And that goes beyond your neurologist or your MS healthcare team. You also need a really good primary care doctor. We depend on our primary care colleagues a lot in the care of an MS patient. A lot of you may have already experienced sometimes when MS symptoms are worse, it's not really the MS, it's something else going on. And a lot of you may have also experienced where something happens and it kind of gets blamed on the MS. And so we really need a partner in terms of caring for you, making sure that everything's being diagnosed appropriately and treated appropriately. You can go to the next slide. All right, next are these chronic symptoms, these day-to-day symptoms. So understanding how to manage this is important because it's different than your disease-modifying treatment, whichever treatment you're taking to try and halt the MS. Chronic symptoms are these things that are separate from any new lesion or new relapse. They're usually due to old lesions that have left you with residual symptoms. And so this can include things like spasticity, bladder problems, fatigue, cognitive symptoms, all of those symptoms that are fairly common. And when to treat, that usually comes down to how bad is it? If it's something that is not particularly bothersome, meaning it does not prevent you from doing the things you enjoy, from the activities you need to do, sleep, that sort of thing, it usually doesn't require treatment. But when it kind of crosses that threshold to now you find that you're not doing the things that you want to do, you can't get in a car and take a 2-hour trip because you're worried you'll have an accident, that sort of thing. Now it's kind of crossed into where it really should be discussed and potentially treated. With taking those treatments, sometimes there'll be a treatment that you're taking daily, sometimes it's just as needed, and that's something to discuss with your healthcare provider. But there are options. Can you stop medications? You can. So again, symptomatic treatment differs from your disease-modifying treatment. As an MS provider, I don't want anyone to just stop their drug because then I know there's this potential for the MS to progress and worsen. The symptomatic treatments, at the end of the day, usually they're not necessarily curing the underlying problem. They're helping you to get through your day better. It's all about wellness and quality of life. And so stopping them isn't going to make the disease progress per se. It just means that the symptoms may come back. And then medication interactions are another challenge because sometimes with different various symptoms coming about, there are a lot of medications that may be started and they can interact with each other. Sedation is common because a lot of these, that's a common side effect with a lot of these medicines. And sometimes you get to a point where you're like, okay, I don't know what's doing what anymore. And I have these side effects and I don't know if it's helping. And in that case, it is important to talk about your concerns and maybe even just peel back one at a time so you have a better idea of what it's doing. If a particular symptom gets worse after you back off a medicine, then you could say in hindsight, that was working, let me restart that one. On the other hand, if you take a medication off and you're like, hey, I don't even feel like anything got worse, then maybe you did not necessarily need that medicine or you don't need it anymore. Next slide. All right, next. So it's important to educate yourself about what resources are available for MS patients. And so there are a lot of MS organizations that are out there that will offer resources, education about the disease and symptoms, pre-support services, health and wellness programs as well. And so they're all listed there, but these are just some examples of organizations that are out there. So engaging with those organizations could definitely provide potential resources that could be helpful. There are medication copay assistance and coupon programs. Even if someone does have insurance, sometimes the copays are still insane. And so using these programs in lieu of that are oftentimes helpful. Engaging with support groups. And then, when you look at exercise and wellness, there's sometimes not everyone has the time or means to get a gym membership or go to the gym. So there's apps and other programs that you can do from home to help out with that. Next slide. Okay, the last thing I want to touch on briefly is just acknowledging mental health needs. So it is important to combat stigma. There are a lot of negative implications to mental health that we need to try to rid ourselves of that stigma. So that's the first thing, talking about it and being, as a community, supportive of one another, encouraging people to talk about these mental health concerns with their healthcare team. It's important to establish a support system. Not everyone has a support system. Some people do, built into their family, for example. If you don't, then establishing one, trying to find that group or people, whether it's through an MS program or your local church, but a support system is really helpful in building that community that you need. So leaning on and engaging with community is important as well. This has been a huge problem, especially in the past few years with the pandemic. There's been just a lack of human interaction. When you have things to do and something to look forward to, there are a lot of positive benefits on mental health. And then lastly, just talk with your healthcare team. There are treatment options. I think sometimes as a community and culture, we tend to say, but I can deal with this. But at the end of the day, you don't have to just deal with it. There are places and things and treatments that are there to help you feel better and improve quality of life. At the end of the day, that's what it's all about, is just making life more enjoyable and leading as normal and happy a life as you can.